finished up talking about the circular bronze, looking at it from my right side. I had trouble visualizing it until I started thinking about looking at it from above. And I really think it's easier to see it this way. Just kind of put everything together. So let's start with, there is one, so the vertebral arteries come up left and right side off the subclavian, and they come together to form one main artery that goes up. What's the name of that artery? Yes, this is your basilar. Oh, okay. So this is a picture of a person looking down on their head. So here's the nose, and there's two ears. So if you had a camera up here, you'd be looking down on my head. So thinking about where the basilar artery is going to come in, there's going to be the basilar right there. Okay, I'll label that. It's your basilar artery. Coming off the basilar artery, and now I think it's a little bit easier to see, you can see that there are two arteries that come off the basilar, just above the level of the third cranial nerve, and then go back to supply the occipital region, which we know is in the back of the head, back here with blood. Okay, so this is going to be the right side, and this is going to be the left side. So what are the name of those arteries coming off the back here? Yeah, these are your PCA. So this is going to be your right PCA, and then this is going to be your left PCA. Okay, right and left PCA is coming off, supplying the occipital area with blood. And that's what you see from above, supplying the anterior portion of the brain with blood. You're going to have two arteries coming up, side by side. Okay, what are the name of the two arteries coming up that split off? Yeah, those are your internal carotid arteries. So here's your right internal carotid, and then this is your left. Okay, right and left internal carotid coming straight up off the common carotid. Now, talk about this artery that comes off and around the level of the eye, and what it does is it goes forward on the right side and then flips around the corpus callosum, and then that's what I'm showing here. This artery on the right and left side goes forward. So what's the name of the artery that goes forward and then flips over the corpus callosum? That's your anterior cerebral artery. So here's your right ACA, and then here's your left ACA. ACA is anterior cerebral artery. Great. Now, I think it's a little bit easier to see in this view. There's one artery that comes off the internal carotid and goes out to supply the lateral surface of your brain with blood. You can see how it goes out that way. Does everybody remember the name of this artery here? Have two of them, right and left? Right and left? MCA, yeah. So here's your right MCA. And then here's your left MCA. Okay, now we're all set up. You can see that if there was no ability to connect the right and left halves of the anterior circulatory system of the brain together, if you lost one whole side, you lose everything. Right? But what nature has created, or God has created, is this small little artery in here that connects the right and left ACA together. Okay, its sole purpose in life is to help the arterial system supply as much of the brain with blood as possible if there was a stroke of some sort, or an ischemic stroke. Okay, this is going to be there's just one of them, anterior communicating artery. Okay, supplies left and right portions of the brain with blood. I said before, there's another artery comes off the right internal carotid, comes back and makes the connection with the PCA on the right side. And then there's another one parallel to it, comes off the left internal carotid and makes a connection with the PCA. And the job of these two small arteries is to connect the anterior and posterior circulatory system, the brain, together. So this would be your left posterior communicating artery. And then this would be your right posterior communicating artery. Okay. And for me, now I can definitely see the circle of Willis. Right? And it's this circle right here. That's your circle of Willis. Questions? Does that make sense? See it from a couple of different viewpoints. Just trying to make things three-dimensional as much as possible so you see where arteries are going. In the next part, we're going to talk about which parts of the brain each of these arteries supplies. No questions? All right, let's move on then. Let's look at the ACA and PCA territories, and this says it's a sagittal section, right? So just straight down the middle, you're looking at the left side of someone's brain, okay? And so this is that major area of white matter called your corpus callosum. So there's your landmark. And this little guy back here is your cerebellum. Okay, so you're just looking at the medial surface of the left, so the left outer side is underneath the paper. You're looking at the inside. And here's your brainstem. So, thinking about the anterior circulatory system, let's go ahead and see if we can draw that in here. Coming off the common carotid, you have your internal carotid. And like I said, it's going to supply the left side. So I'm just going to draw the left side. The left internal carotid is going to come all the way up here, and about the level of the eye. It's going to flip over the corpus callosum and supply all this area with blood. Okay, remember the MCA is going to come. It's going to go back out the other side. So we're not going to worry about that one right now. So what's the name of this artery that flips over corpus callosum again? Anybody remember? Left ACA, anterior cerebral artery. And then this is going to be your left internal carotid. We're thinking about the ACA, anterior cerebral artery, the area of the brain that it supplies with blood is going to be all in here in the red color. So it's going to come off and supply this area, and then it's going to come out here and supply this area. It's mostly the frontal, medial surface, but then it's going to flip around. You're going to get a little bit of the lateral surface of the brain. Okay, so all of this medial surface up in here is ACA territory, but then there's a little flip. We'll talk about the importance of that with the next drawing. But you should know ACA is a big supplier of the frontal lobe medial surface all the way across. most of the medial surface of the brain, the parietal lobe and the frontal lobe for sure, kind of cuts off there. Okay. Everybody good with that? That's the anterior cerebral arteries territory. That means all that area of the brain is supplied by the ACA with blood. It's the majority of the medial surface of the brain, both frontal and parietal lobes, as well as a little bit of the lateral surface. It's just a little flip over the outside. Okay, thinking about the posterior circulatory system, the vertebral basilar system. We know that we're just going to do the left. So coming up, there's the vertebral arteries about the level of the pontomedullary junction, come up to form one main artery. It's going to run right up along here on the pons, and then just above the level of the third cranial nerve, we're going to come back, and we're just going to look at the left portion. Okay, so this is your basilar. And then this is going to be your left PCA, posterior cerebral artery. And like I said, that artery is going to, and its main job is going to be to supply the occipital lobe, but it essentially has all of this territory. It doesn't flip over. It just supplies the entire territory on the medial surface, and we'll see in a minute most of the lateral surface as well. So it gets everything in here. That's why. Okay, so essentially that's the surface area that's covered by the posterior cerebral artery. And you notice there's a lot of space in here in the middle. And this is where the thalamus, we talked about the thalamus, I may have mentioned basal ganglia, caudate nucleus, those sorts of things. A lot of nuclei, which are just neural cell bodies, so the gray matter, a lot of gray matter in here. And the gray matter is kind of divided up as far as who supplies it with blood. So don't fuss with it for the purpose of understanding this material, or we won't even touch it next year, maybe a little bit. But for the most part, this area contains a lot of the nuclei, supplied by a little bit by the MCA, a little bit by PCA, a little bit by ACA, but not really important for knowing how to be a PT. Okay, questions about this? Okay, now looking at this is the medial surface, the middle surface, the inside surface. Let's go ahead and look at the outer surface. So this is going to be the lateral surface of the brain. Yeah, here you're going to see PCA, MCA, and ACA territories all coming together. Let's start out. So what you're looking at here, this would be the right side. Okay, so you're looking at the outside of the right side of my brain. There's a standard boxing glove, and let's go ahead and start labeling some of these things. What lobe is this again? Anybody remember? Temporal. This is your temporal lobe. Okay. Coming in here, which lobe is this? Frontal. As separating the frontal lobe from the next lobe in sequence, we talked about an important sulcus here. So if I remember the name of that sulcus, that's your central sulcus. Awesome. Okay, so everybody see where we are. This would be the right side of the outside of the brain. Is there a question? Okay. Behind the central sulcus, what's this next lobe? Parietal. Okay, and behind the parietal, way back here in the back, responsible for vision, is your occipital. Okay, so I talked about this a little bit, and now I can show it happening. This is going to be, what's this fissure called? That's your lateral fissure. lateral fissure. Longitudinal is separating right and left halves of the brain. It's going to be up top. You can't see it from this view. But your lateral fissure is going to separate your temporal lobe from your frontal and parietal lobe. Okay, still adding parts here. Getting there. I'm going to use gray here. In front of the central sulcus, there's an important gyrus that we were talking about that's responsible for motor functions. Anyone remember the name of that one? Good. It's your precentral gyrus. Okay. And inside your precentral gyrus, there's a little homunculus. Was he standing on his head or his feet? He's on his head. Here's his head down here. And he's got a body here, and I sort of showed it a little bit, but maybe now it'll come through a little bit clearer. His feet come out, and then they flip over just a little bit. And then his arms are kind of in here. Okay, and we mentioned that, so I'm just going to go ahead and label it. This is your pre-central gyrus. And that's going to be responsible for motor function. Okay, and then in the parietal lobe, so precentral gyrus is in part of the frontal lobe. In the parietal lobe, just behind the central sulcus, there's another important area that we talked about. What's the name of that? Great. Post-central gyrus. Okay, and the post-central gyrus, again, has a nice little homunculus. Person here, same deal, his feet flip over just a little bit. That's your post. Central gyrus. Do you have a question, Alexis? No?
Why does feet in here?
Because that's the topography of the brain. Let's see what I can give you. But you're going to see why that's important here in a minute. Guaranteed. Any other questions? That's exactly why I show it that way. Exactly. I want you to see something here. Any other questions? All right. I think we got all the pieces, parts in here that we're going to need. I'm going to choose to represent the MCA, just for ease of colors, looking at, I'm going to choose to represent the MCA in blue. I know it's part of the anterior circulatory system of the brain, but I don't want it to clash with the ACA, because the difference is pretty important. Now, where did I say that the MCA appears on the lateral surface of the brain? Where does it come through? Does anybody remember? Yeah, it comes through here at the lateral fissure. So what happens is you have the MCA poking its head out right there. I'll label that. There have been people who are asking about the territories of different things. MCA has a huge territory on the covers the majority of the lateral surface of the brain. So what you see is that the MCA has a territory that's all going to be in blue here. Comes out like this. So I'm going to run out of blue. That's 9 here. And this is all MCA territory. All that. And then somebody asked about the temporal lobe. So the MCA is going to supply most of the temporal lobe. should come through about half of it. Kind of figures off there. Okay, that is, everything you see in blue there is MCA territory. Okay, the MCA supplies that part of the brain with blood. Let's go back and look at the PCA territory. Since the PCA was part of the vertebral-basilar system, I'll stick with the green. And the PCA territory, remember the PCA comes up and shoots off, it shoots all the way through, okay? And PCA is going to supply this area of the brain. Occipital lobe on the lateral surface, all of it is supplied by the PCA. And as you get down here to the temporal lobe, it's also going to supply some of the temporal lobe with blood, especially on the inferior portion here. Okay, now, the star of the show comes back with the ACA. They show the ACA in red. If you remember, the ACA came from the medial surface and came up and did a little flip. Well, when it does its little flip, it does that. So the MCA doesn't quite reach all the way to the outside, and what happens is the ACA takes over that little bit. Here's the important part. Since the ACA comes out and flips a little bit over, it hits a special part of the homunculi. Okay, that's ACA territory in red. So the question is, if somebody has a stroke that has affected their ACA, would you expect their upper extremities or lower extremities to be weaker? Lower. That's it. That's why it flips over, Alexis. That's exactly why. Because the legs are involved. Those neuronal cell bodies receive circulation from the anterior cerebral artery. Okay, same thing with MCA. Okay, you have a patient who's got an MCA. Would you expect their arms or legs to be weaker? And how about their trunk and their face? Could be anything, right? But probably arms are going to be weaker than legs. Now, how about if it's a left MCA CVA? Left MCA CVA, what kind of patient presentation might you expect? Or could you expect? What side of the body is going to be affected, right or left? Right. Are they going to be, what kinds of symptoms might you see? Paralysis, weakness. So, did I say right MCA, CVA, or is left MCA? So, right MCA is going to be affecting the left side. I might see sensory deficits, sensory loss, right? Because this post-central gyrus has been hit. I might see weakness. But specifically, I'm going to see weakness in the trunk, arms, or face, depending on where the site of the stroke was. It's just that simple. And like I said before, PCA supplies the occipital lobe, so I'm going to expect visual difficulties. Okay? It all goes away from there. Questions? Does that make sense? Okay, cortical region supplies opposite side of the body. Questions? No more? No more questions? You got it? Okay, let's take a little quiz. It's fun.